Thank you.
It started now, Christina.
Well, thanks, Vasako. Thanks, Christina. We'll get cracking. I expect we'll have people joining us a bit for the next few minutes. But I know our schedule for today and our programme is really tight, so we're really keen to start on time, if that's okay. So afternoon, everyone, and a very warm welcome to today's Respiratory Matters webinar. Thank you for joining us. For those I haven't met before, I'm Jo Oliver. I'm the Respiratory and Diabetes Network Manager at NHS Wales Performance and Improvement. And it's great to see so many of you with us today. These webinars are designed to bring colleagues together, share useful information and learning, and really shine a light on the excellent work that's happening across Wales. Whether you join us regularly or this is the first time, you're all really very welcome, and we really hope you enjoy the session today. So before we start, just a few quick housekeeping notes, if that's okay, before we get started. If you can keep your microphone muted and your camera switched off, that'd be great. Today's webinar is being recorded and will be available on the Respiratory Matters Teams channel and on our network webpage as well. If you've got any questions at any point, just feel free to add them into the chat bar. We'll keep a track of everything and cover as many questions as we can during the Q&A session at the end. If we do run out of time, we'll be sending out the answers to the questions following the session today as well. We're able to offer certificates of attendance if that would be helpful, but we're only able to provide these for those attending the live session. If you'd like a certificate, just request it in the chat before the webinar ends, and then we can record your attendance and send you that certificate afterwards. Unfortunately, we're not able to issue, as I say, certificates to anyone who watches the recording afterwards, but I hope that's okay and that's understandable with everybody. So today's session, it's all about celebrating collaboration. The development of our Breathlessness Pathway has involved colleagues from across our clinical networks, digital and data teams, our value transformation team, and our industry partners. It's been genuinely a shared effort, and today we want to reflect on what's really worked well and what we've learned along the way, and how this kind of partnership working strengthens our services for people across Wales. So before I hand over, I just want to introduce our speakers for this afternoon. First of all, Anthony Gibson, our clinical lead for the Respiratory Network and the Breathlessness Pathway will kick off. Then Andrea Pace, our Assistant Network Manager, will be leading our interview style discussions. Arthur Duncan Jones is our Health Intelligence Manager within our Value Transformation team. And Louise Goswell is our, well, not our, but Pathway Manager from AstraZeneca UK Pathways team. And then Sarah Pantoni is our Senior Programme Lead from Value Transformation team. So we're delighted to have such a diverse group of colleagues with us today, each bringing a different perspective on collaboration, shared delivery, but really working as one. So to get us started, I'm really pleased to hand over to Anthony, who will set the scene and reflect on the collaborative journey we've been on so far. So thanks, Anthony, over to you.
Hi, afternoon, everyone, and thanks for joining. I think what we just wanted to do at sort of the end of the financial year was just take the opportunity to share the potential of being able to work in collaboration across not just over different departments within NHS P&I, but also with our partners in industry. And I think before I move on to talk about the Breathlessness Pathway, it's worth just reflecting on some of the work that's been done across the system in collaboration. There's been some amazing work done in the severe asthma space, both in Aneurin Bevan and up in Betsy. colleagues in Hywel Dda and Naran Bevan have been doing a collaborative piece of work around a COPD template. Some of you may well be aware of the COPE program. And there's also the ongoing collaborative work with our industry partner ICST around the My COPD and My Asthma app. We're very much aware in the network that we're all working under a constrained system, both in terms of finance and people and time, and being able to work in partnership, jointly with industry in a very much non-promotional way. And I think it's really important to stress that we do this in a non-promotional way with their non-promotional arm of their company to allow us to accelerate the development and accelerate the delivery of some of the work that we've been able to do across the respiratory network has been crucial. And I think we wouldn't have been able to have made the progress we have this year without that support and that joint working. In terms of the sort of level of collaboration across the Breathlessness Pathway, this was a pathway that was designed in collaboration. We held workshops, 3 workshops across Wales to gain people's thoughts and enthusiasm. And we had about 250 people, I think, attend those 3 workshops and input into the design. And what we were able to draw on, for example, with AZ was around actually being able to use their expertise and their training and.
Oh, you've gone on mute, Anthony, for a second there.
Don't know how that happened. Sorry. Facilitating quite large, as anyone on here knows, large groups of clinicians can be an unruly group when we're trying to bring them together, and that was the first real benefit that we got in that point. But then also around the pathway design, linking in with, colleagues who had experience in health economics. It's been a real privilege and a benefit to be able to draw on experience that we don't have within the NHS in Wales. And I know colleagues who've worked in partnership in other areas, and I've only touched on some. There are a lot of smaller projects being done in collaboration across Wales. So part of today is to show you what we've done, but also hopefully show you the opportunities that could be there within your own service and with your own areas of work, where a collaborative approach would allow you to do something that maybe at the moment you haven't got the resources to do. So it's just to hopefully at the end of this you can go in and think, oh, actually maybe I could do this, and we'd be very keen to signpost you to people who might be able to help. So that's the brief introduction to the session, and you've got. I think I'm answering a couple of questions, but you won't have to put up with me much longer, and you'll get the far more interesting people on after me. All right.
Thanks, Anthony. Thanks. So thanks, we'll move on, Andrea, for you now, and I know you're going to be leading the interview, so I'll pass on to you. Thanks.
Thank you, and thanks for your setting the scene, Anthony. So before I move on to Arthur, I just want to ask you a few questions. So why is collaborating with industry partners valuable? I know you just covered some of it, but if you could just extend a bit.
I mean, I think, the bit that I talked about before is about capacity, and I don't think it's about capability. We have a lot of capability within the NHS in Wales to do this, but often it's capacity, and particularly capacity in some of those skills around end-to-end pathway development. It's not something we've done a lot of in Wales before, and being able to draw on the pathway team, for example, in AZ, who have got years of experience of supporting healthcare systems to develop new ways of working and different pathways, we wouldn't have been able to make the pace of progress that we had. And I think that there is a different approach, particularly from pharma companies within Wales at the moment, is that they are really keen that their drugs get into the right people. So they are really keen that the pathways work, because they want to be, from their point of view, they want to be able to show that they work. And if we don't get them into the right groups of people, then that dilutes the whole benefit of the medication that they have anyway. So that's the way they're coming from. And then there are areas of expertise that we don't have in Wales. So we don't have particularly available within the existing NHS, health economics, some of the experience in transferring when you read a clinical trial into real data. So there's really useful skills that we can do, and also they do. We talk about money. They do come with a bit of funding that allow you to organise these things.
Yeah.
So we can't just say this is all. It does come with the support to be able to bring people together, to be able to feed people when you bring people together, to be able to support some of the high level visual stuff that makes it much easier for people to understand. So that's the real benefit I think we've seen across the system. But the other thing I think is to be really clear is that it has shown some really significant patient impacts. So particularly in some of the more advanced work, say the severe asthma work that they've supported up in Anara and Bevan, we're now starting to see, as a consequence of that, improved not only waiting times but actually patient outcomes. And I think so that again shows the value of it.
Yeah. Okay, thank you. I'll let you draw breath now. And I'll move on to Arthur. Thank you, Anthony. So Arthur, Joe's already obviously introduced you, so we'll get straight into it. Thank you for coming here today. We're sharing a room now in River House and just giving us the opportunity to chat about the collaborative work that we've done, the evaluation framework as part of the Breathlessness Pathway. So my first question comes into, so it's about the Breathlessness Pathway evaluation framework and how has it supported the pathway work. So let's start with, first of all, for people who don't know, what is the evaluation framework?
Well, yeah, thanks, Andrea, for having me. It's not obvious that we always get the chance to talk about the stuff that we've been working on, so This is great. So yeah, the evaluation framework is essentially a structured way of defining what success looks like for the breathlessness pathway. It brought together the agreed indicators that we've been sort of developing, those data sources that were going to feed those indicators, and sort of all the template information related to EMIS web into one place. The indicators, as I mentioned, kind of cover off both the process measures for the pathway. So this is sort of the number of people who are referred or coming through the door, and how long it takes to get that sort of referral to appointment, and then appointment to diagnosis, and what happens to them when they leave the pathway. But also, perhaps most importantly, it also includes those patient-reported outcome and experience measures, which obviously, if we're moving into sort of value-based healthcare, that's really, really important. So yeah, the framework essentially acts as a guide for our pathway partners to ensure that everyone understands what is being measured and why, and hopefully provides a through line from those pathway objectives to the indicators, and then the data, and finally from the data to reporting.
Right. And how has it supported the actual pathway work?
Yeah, a really important part of it. So yeah, the framework has really helped to keep the development of the pathway focused on those outcomes and sort of moving away just from the process measures. So essentially, we were able to define indicators relatively early, which meant that discussions could be more focused on how will this actually improve patient care and experience, rather than just numbers of people coming through the door. It's also enabled pragmatic choices. So we've been able to map those indicators against the real world data availability, and doing so has allowed us to essentially refine and adjust those measures where necessary. And I think finally, again, it's helped provide that foundation for future improvement. So the indicators exist in that one place, and they are owned by the people who essentially created them. So hopefully the framework gives the pilot sites a clear starting point to test what works, gather that feedback, and hopefully improve the pathway over time.
Yeah, whenever you talk about the evaluation framework, I always think about that unicorn list that we started, and how it was like the big blue sky thinking vision, but the reality of what we can get, but more importantly, what is it that we need? Okay, so what do you think have been the biggest enablers in pulling the Breathlessness Pathway framework, evaluation framework together?
Yeah, I think that Anthony's probably touched on some of it already, but I think the biggest enabler is that it's been created by a multi-background and multidisciplinary team. This has really allowed those subject matter experts to identify the suitable indicators that they've also then been responsible for in both of the indicator definition, but also how we're actually going to go out and collect that information. I would say it's also really benefited the framework from going through multiple iterations.
Yeah.
As you've already alluded to, we didn't come up with the final list to begin with, and certainly it's gone from that sort of initial scoping phase to define those indicators, and now we're really in the implementation phase of how can we actually get that data and extract it using EMIS Web. Speaking of EMIS Web, of course, the other big enabler has been DHCW.
Yeah.
We've been really well supported by them, and they've led on the procurement of EMIS and have engaged with Optum, who I think own EMIS essentially.
They do, yeah.
And they've really helped me understand personally what data can be captured and how it can be extracted. But I think they've been invaluable with sort of how we move into that.
Their support and their speciality and understanding and their expertise they have.
Absolutely. Yeah. And I think, again, linked into that, the final thing really has been that sort of regular communication. So as part of the sort of creation of the pathway, a series of subgroups are set up, including the data and digital and evaluation subgroup. And there's sort of been those regular meetings where we've been able to feedback on progress, gather feedback from the different people. But I know that I've also had lots of conversations with people about specific indicators in between those sort of regular meetings. So that's really helped sort of push things forward.
Yeah. Okay. Thank you. So what data and digital considerations would you recommend networks to think about when they're developing pathways?
I think more generally, and again, it's sort of going back to sort of, I think, May or June of last year, the key thing that has been really good for myself on the data side, but also colleagues on the digital side, is that we've been including those conversations as early as possible. And I think, it's not always the case, but it certainly was the case with the Breathlessness Pathway. I think from a digital perspective, that early engagement has allowed sort of Ian and colleagues to sort of map out what the pathway looked like on the digital systems, and in theory identify possible bottlenecks. And similarly, from the data perspective, we've gone, as I said, we've gone through that sort of iterations of the evaluation framework, which wouldn't have been possible if we were just talking about it now, sort of 6 months down the line. So that's been really good. You've also, I think, alluded to it with that unicorn list, but I think it's really important to be aspirational when you're creating an evaluation framework, but also be sort of realistic about what's actually possible within the confines of NHS digital systems. And there's certainly been a couple of instances where we've either had to adjust or drop some indicators because they just weren't feasible. And certainly, we've, I think, come to a sort of a more streamlined version because of that. And I think then finally, and this will hopefully be true, or hopefully not be true, but maybe true, is that you're probably not going to get it right first time.
No.
So even up to this point, everything has been sort of in that theoretical phase. And as we move again into implementation, what we thought was important from a data perspective may actually not be so important, or things which we hadn't considered are actually really important. And so I think it's really important that we are able to sort of pivot as we go into the implementation of the pilot sites. And that's why having those pilot sites is going to be hugely beneficial for how things work moving forward. Yeah,
definitely. And so moving on from the breathless pathway, because we breathe that day in, day out. So other work, you've developed the National Respiratory Dashboard. So how has that collaboration helped to develop the baseline dashboard?
Yeah, and I suppose the positive thing is that what I'm going to say about this is probably not dissimilar to what I said about the Breathlessness Pathway, and that the collaboration has been hugely important for that as well. Essentially, certainly early engagement with the Respiratory Network to identify that core set of indicators, again, starting off unicorn list, but starting off a small unicorn list. So we know these are the things that matter, and essentially trying to get that minimum viable project out as quickly as possible. So I think in discussions with yourself and the team, we came at this sort of the key respiratory outcomes, so mortality, admissions, and that sort of thing, but also that NRAP audit data. But once that was in the dashboard, it was okay, how can we share that information with the wider respiratory community? So there was a couple of demonstrations had at the clinical reference groups, and I think that's really led to sort of the cyclical nature of how the dashboard has been developed since then. So off the back of that, met with colleagues from sort of primary care and smoking cessation teams at NHS Wales, and that's then allowed me to add information around smoking cessation data, but also inhaler prescribing from the primary care side. And essentially this is sort of continued where the circuit people who have seen the dashboard has increased, taken feedback on from them, added indicators, and essentially that's how it's got to the point where it is now.
And it is very useful because I know we use it for Welsh Government to triangulate information. So yeah, it's not just we've got a dashboard, we use it. So just last question. So what advice would you give to other networks trying to build useful dashboards?
I think useful is the operative word there, Andrea. I think from my perspective, having that clear aim and intended audience for the dashboard, essentially what is the question that dashboard is trying to answer. I think certainly in the case of the respiratory dashboard, Anthony has been clear that it's a core set of high-level indicators with the game of getting sort of respiratory colleagues that don't always look at data to actually look at that data. And I think sort of this is what feeds into that, is that while it may sound counterintuitive, I think sometimes with that sort of what question trying to answer, a less is more approach actually works better. Quite often you'll see a dashboard that has 400 indicators with 500 breakdowns, and actually you can kind of get the sort of the answer is lost within all all those options. And so actually having sort of fewer things that people can click on, but actually what do we care about is really, really useful. And then finally, so just to say, starting small and developing over time, not
building it.
We don't always know what's important when you start making it. So if I'd had 100 indicators to work through, I could have got to the first 20 and we would have realised it wasn't going in the right direction. So we've really been able to work out what is the best thing.
Okay, thank you. So first of all, you've got me looking at the dashboard and data, so that's a definite win there. So thanks Arthur, thanks for your time, and again thanks for your support to the network and all the work you do with us, and especially the webinars and tuning at events to give updates. We do really appreciate it. Thank you so much. Okay, so I'm going to move on to Louise.
Hi, Andrea. I'm sorry I'm not sitting next to you.
Yeah, it's quite nice. It's a nice change today. So yeah, lovely to see you, and thank you for making the time to attend the webinar and talk about AstraZeneca and the network collaboration on the Breathlessness Pathway. So my first question to you is, what made the co-production approach successful, and what would you recommend to others starting similar work?
Thank you, Andrea. And firstly, just before I jump into questions, a huge thanks for having me on the webinar today, and lovely to have all of those on the call. For those of you that don't know me, as I said, I'm Louise, and I've been supporting the Breathlessness Pathway as a pathway manager in AstraZeneca. Well, Andrea, the success to me with regards to sort of the co-production right from the start was the foundations. And what I mean by that was it was starkly obvious when we sort of all met as a network, probably about a year ago now, the clinical leadership from Anthony and you as a network was incredibly palpable, strong. And I think when we talk about foundations and any partnership work that we do across the NHS, the clinical leadership is really, really key to unlocking the work that we start moving forward. And I think it was really stark. So that was the first sort of piece for me that was really from the first time that we met and started talking about the breathlessness pathway. When you have that strong clinical leadership, it leads very nicely into having a real clear sort of vision and direction of where you want to travel. And again, when we work with NHS partners, sometimes getting to that point is quite difficult, is that it's not that clear around what the burning platform is in the case for change. And actually the vision isn't fully understood yet. But I come back to when we first met with Anthony and yourself and Joe and Christina, the clarity on the burning platform was very, very clear as to why you needed to do this, and therefore the vision that we work towards as a group was really, really, really easy. And it's that vision that sort of forms the foundation of the work that we did. It was a shared vision. It wasn't just a vision that you made up as an individual. It was a team effort as understanding what the vision was, and therefore having that clear sort of gold star ahead of us. All the work that sort of followed was around it sort of sat around that vision. So that was for me the sort of, and that's how we work as pathway managers, is whenever we start partnering and for successful collaboration, those foundations are really, really key. And then, as you know, we met regularly on a regular basis working on that vision. And there's a huge piece around trust and respect in those meetings, and understanding our roles and responsibilities as a stakeholder team. And I think that, again, once we'd developed that vision, we all knew as individuals in those group meetings, as it was very action focused, we knew what we were there to do and what we were there to provide. And I think for me, it was those foundations that sort of set the success of the co-production in the Breathlessness Pathway. And then we, of course, moved into, as Anthony alluded to, the face-to-face sessions. So, you know, the foundations were really, really strong. But of course, in any co-production of a pathway that has been so ambitious set by you guys, is that face-to-face connection with clinical and non-clinical team on the ground was absolutely key. And I think that's a huge part of good foundations, face-to-face, giving people that opportunity that they have a voice in the co-production of the piece of work.
Yeah, absolutely. The strong leadership is so important, and also having those face-to-face meetings. It was in regular meetings. We're ensuring we were maintaining that momentum.
Indeed.
Which obviously you're on top of it all the time, and it just did make such a big difference.
It really did.
So, what were there any challenges or barriers that you had to overcome?
Do you know what? Because we're talking about, you know, the subject of collaboration, when I thought of my instant reaction was no. In terms of, were there any barriers or challenges to collaboration with you and Wales on this Breathlessness Pathway? The answer, honestly, was no. And I think that's because of those strong foundations right from the start, and that trust and respect. The challenge that we had as a group and as a wider stakeholder team was the complexity of the piece of work that you've taken on. So it was very, very clear that, you know, the nuances, well, I've learned a lot about Wales, having driven end to end of the country now. The geography that you have to challenge, you know, whenever you're designing anything, the nuances within different parts of the country. You know, the digital maturity of you as a system is, you know, Arthur and team have been absolutely phenomenal in supporting that. But that's a barrier. But that was nothing to do collaboration. Everyone had that shared vision. It was just the challenges of working in healthcare, the challenges of creating a sort of national approach to breathlessness. You know, it came with challenges, but certainly in terms of that collaboration piece, I suppose that the one aspect that those face-to-face meetings were brilliant for is that we wanted everyone to have a voice. So if there was any challenge or any uncertainty from clinicians, non-clinicians within that team, they had that forum in those face-to-face sessions to express that. And that is so, so important. It wasn't us saying, this is how we're going to do it. We want to hear the challenges. So, and we did hear them. And it was a really, hopefully, I felt a really sort of positive experience to hear the good, but to hear the challenge as well. So we heard it, but I didn't feel collaboration was the challenge. It was just the work is a challenging piece of work to do.
Yeah. And I know when we've spoken before, you said, you know, the united, let's solve it together approach was key as well to overcoming some of the structural and cultural barriers.
Yeah.
Or as I like to say, as Anthony says, JDI, just do it. So that definitely helps.
Absolutely.
So what did you learn then from working not just with the network, but directly with stakeholders across Wales? You alluded to in your last question, but is there anything in particular?
Well, I mean, Anthony sort of in his opening sort of summary, I think the fact of the matter as to the attendance that we had in those face-to-face events, the engagement in Wales for this piece of work was incredible. I was bowled over by the attendance that we had in all of those 3 sessions. We were taking people out of their incredibly busy clinical, non-clinical, you know, their world of work. We're bringing them out. It just showed me the sort of passion and the drive that everyone feels that they want to be part of this piece of work. So that engagement, having worked with you, as I said, as a network, but as a much bigger team in Wales. The engagement was palpable just based on the presence there, and these rooms were not quiet, as we all know. Everyone spoke. It wasn't difficult to facilitate from that perspective, because the passion and putting the patient central to all the work that you've done, it's always been about the patient, which again, it is the right thing, but it never wavered in any of those sessions. So, and Anthony also alluded to the fact that you have the expertise. There is no doubt the expertise across the country in terms of everyone are experts within their own right. It's just sometimes the time to be able to give to this, but the passion, the expertise was incredible, and the engagement was it just made the work that I needed to do incredibly a lot easier. And out of the face-to-face events, we also ran those virtual sessions to map that pathway and get into the, just to sense check any gaps that we were missing. The attendance at those, Andrea, were incredibly well attended. So to be doing this alongside your business as usual, it just told me that your engagement across the country in this kind of work was it's not to be not talked about, because that should never be assumed. It doesn't always happen. So, and I think that does come from all the work you have done in raising the profile of this piece of work. I know there's been a huge amount of work that you have done as networks to sort of raise the profile and keep people informed, because that's really important too, isn't it? To keep the people engaged,
to keep the momentum, and otherwise they think, what happened to that project?
That's right. How many meetings have we been to that that hasn't had an output?
So in the future, what role can industry play in supporting meaningful NHS transformation for people who haven't worked with industry before?
So I think, again, thank you to Anthony, because he alluded to the fact that there is a lot that the industry can support with in collaboration, and hopefully the work, I mean, you've done so much work with industry already in that non-promotional sense. Now, again, we come with, as pathway managers, the one thing that I always say to everyone was, we don't come with a box of tricks. We don't come with a solution. The whole idea of pure partnership and collaboration is working with you. And I think that's something that's really, really key to understand when you are engaging in industry. We come with expertise. We obviously come with capacity solutions. We also, you'll know, Andrea, if we needed support in those infographics, I supported, but I certainly didn't write them. So we do have people within the business that can support and essentially make your boat row faster. That's the whole key. And that's what, again, Anthony has alluded to, is the fact that you have the expertise. My job as a pathway manager is to support that momentum, pull in what we can from the business to support and make that boat go faster. So I think it's about breaking those barriers down and understanding that there is a lot to offer, but the burning platform, super important, is what is the problem that you're trying to fix, and what's the vision, and working to that to gain those good foundations.
And I think legacy is, especially working with pharma, we shouldn't be working with pharma, but I think we've changed our stakeholders' perception of that, definitely, because initially there was a lot of nervousness, but once we went in and told them we were working with the educational arm, it was nothing to do with any commercial, and then they met you, and we had the contract. It was a 180 turn, which I think is a massive achievement in itself. So
absolutely.
Okay, so before we close our little chat, is there anything else you would like to add?
Do you know what? No, other than a huge thanks to you, and again, this has not been anything other than a huge success and a joy to work on, purely because of that collaboration. And I think, as I said, just to sort of summarize what I feel has made this be such a success in a really considerable short period of time, it's anchoring work with strong leadership. So that is at the core of successful partnership. That shared vision being really explicit and sharing that far and wide across all people that are part of this piece of work, is building teams around I think appreciating that change is difficult. So
Yeah.
change management is something at the core of us as pathway managers. That's what we sort of manage as such. Change is hard, and I think it's about, you know, talking about that, but keeping your eye on that vision as to that gold star of where everyone wants to head, and, you know, leverage on the strengths of all partners, all people within your stakeholder group, industry, NHS, etc. You know, we do things better together, and I think that's sort of my closing point. It's been an absolute joy and an honour to be working with you and the team. So thank you.
Thank you, Lou. And, you know, I could not have put that better myself. And I would like to thank you and your team, you know, your hard work to support the network to drive the Breathlessness Pathway forward. And I know we'll still be working together, you know, 26, 27 on the Breathlessness Pathway, but we have learned as a network so much from you. And yeah, we'll be looking forward to working on other projects again with you.
Thank
you so
Andrea.
much.
Thank you. Pleasure.
You. Right, let me turn this back. Oh. Okay, our last interview, or just general chat, I think it's easier. So Sarah, we've done the introductions earlier, who'll be attending and who'll be chatting to. I know you've rushed back from Nantgarw, so I do appreciate you making the effort and being on time. So right, let's start off. So tell us what has been your main involvement with the Respiratory Network to date.
Sure, thank you. It's very much focused around PROMs, the use of PROMs, and I would class it as two buckets, if you want, some of which has been supporting the breathlessness hubs, some of which has been around the selection of PROMs that could be used as part of the work and a part of the pathway, but also doing some bespoke analysis, symptoms-based analysis, using existing PROMs that we have in other projects. That could help inform the makeup, if you want, of the hubs to understand where the needs within those regions where of people reporting breathlessness. But as I said, the PROM selection, I think, has been a theme bigger than the breathlessness hub. So we've looked across what could be used in other conditions, and I know that COPD, for example, is something that we discussed. But again, thinking how some of the multimorbidity works together. So patients, for example, that might go through the breathlessness hub may have heart failure, for example, which will also be collecting PROMs for heart failure specific. So it's how everything works together and how we can make sure that we have a person-centered view of the patient's needs.
So I think everybody, well, not everybody, I knew what PROMs meant when we started working with you, because I obviously come across it before, but not to the in-depth knowledge how it's collected, what you need to do. It's a whole massive process, isn't it? So having that insight now is really, really helpful. So can you explain then what PROMs are and why we should consider their use in not just respiratory conditions, but in all other conditions?
Absolutely. So PROMs, I would say they're clever questionnaires, if you want. They've been developed, or they're meant to have been developed in partnership between clinicians and patients to look at the symptoms burden of certain conditions. They come in different arms. Some of them might be more generic about quality of life, and some might be very specific, like heart failure, COPD, breathlessness. And ideally, you probably want a combination of the two to give you that holistic patient's view. What PROMs are not necessarily left for all, so they won't always be appropriate for everything. It's just another tool within the clinician's armory, if you want. When it comes to using them, I always like to think of it as a pyramid of needs, if you want. The primary needs, I would say, is that of the clinical encounter. So the individual PROMs for that individual patients that will help clinician informs that consultation that is based on the patient's response outcomes and also unmet needs, so that you can support shared decision making, for example. But as you aggregate that data, so you start looking at cohort of patient, then you can use it for example, service planning, business cases, trying to understand the unmet needs as a population as a whole. So that's when perhaps it's more useful as a full pathway data gathering, so that you understand where your resources are, what is working well within a full pathway of care. And then you have the tip of the pyramid, I would say, which is your population. So what are the outcomes at an all Wales level, for example, which will be something that the network, for example, because of your national position, would be very interested in understanding the impact at national level.
Right, okay. So what is your advice to anyone interested in exploring proms? Where would they start?
I think it's always start from what you're trying to achieve. So always start from your aim. And as I said, it could be used in so many different ways. It's really helpful to really understand what it is that you want out of them and why you want a prom. As I said, they're not always useful or helpful for everything. So it's really helpful to understand what it is that you're trying to achieve. And then don't try and do this in isolation. There is plenty of support across the system, a national level within PNI, but also within the health boards with value-based healthcare teams across all of the health boards. And both of them can really help you from deciding what you want to collect, looking at what is available, the digital solution to help you implement them, and then the using of the data. So I think don't feel that you have to work in isolation. There is a lot of support there from different people within the system. And I think this is where the role of the networks can really help us as well, because it can help us pull us together and make sure that we do, for example, the selection, we can do it once for Wales, the licensing and translation, we could do it once for Wales, and making it easier then to actually make it work within the clinical environment.
Yeah, because all the health boards have the same digital solution for, is it Promptly for?
Promptly is across 5 of the health boards.
Okay.
So not necessarily across all of Wales. I think there is a hope that it will provide that, whether it's Promptly or other platform.
Right.
To a certain extent, we have defined the national standards that we want from any prompts platform. We have identified 5 within the industry that could answer our needs. But Promptly, as it happens, is the one that has been selected so far for most of them.
Okay, that's good to know. And like you said, the teams are in the local health, in each health board, so we can reach out to them to help as well as your team.
Absolutely.
Within performance and
the network as well. You know, we work so collaboratively together. So absolutely, just reach out and don't try and do it alone.
Absolutely. So what do you see as the next steps for the network and the selection and the work carrying on for proms?
I think the breathlessness hubs would be really interesting. I think they're helping us move into an area that we haven't necessarily explored so much for proms in a systematic way, which is that primary community care element. So I think there's a lot of learning that we can take from these 3 hubs, the pilot side, to then upscale it. Bigger benefit, I think, than just the breathlessness pathway from a system point of view, from how we learn to do this and the benefits. And then I think it'd be interesting then to look at other condition and other pathways of care. So COPD is one, for example, that we have discussed in the past. And I think, again, I'd be very keen to keep that collaboration with the Respiratory Network. What conditions we may want to look at and how we embed that within that full pathway of care.
Okay, well, thank you, Sarah, for giving us the opportunity to discuss the proms and some of the processes and knowing the support is now in the health boards out there for just not for ourselves. We know that we've started to meet them, especially in the pilot hubs, but for other networks. And I'd like to thank you for your continued support of the network. I'm looking forward to working with you next financial year. Is there anything else you would like to add at this moment?
I think the others have already said it as well. It's just a thank you back to everybody that's been involved so far, because the clinical leadership that we've been able to access through the network has been fantastic. The support that you and your team have given us has been so great and appreciated. And I think we hopefully on both sides look forward to carry on with that.
Absolutely. It is really a massive collaboration, isn't it? Thank you, Sarah. Okay, Jo, I'm going to come back over to you now.
Yeah, lovely.
Thank you.
Thanks. A really engaging discussion with all of our colleagues today. So thank you. That was really good. Glad to say we have got time now for questions. So if you've got any burning questions for any of our team members today who've been chatting with Andrea, just raise your hand, or if you wanted to add the questions in the chat, then we'll work our way through as many as we can now. If we don't get time to answer all of the questions, we can follow up with answers afterwards. So open to everybody. Fire away if you've got any burning questions for anybody who's been chatting.
Stunned them into silence.
Yeah. So maybe I'll just start then by asking a quick question to the audience. Obviously, we've hopefully demonstrated that working collaboratively is the way forward, and it was great to hear, Louise, from you to say that as our industry partner, that you engaging with us didn't sort of bring up any big challenges. But again, I guess there are challenges for all of us working across the different settings, but also with digital as well. I guess one question, if you could change one thing that had happened over the past year, Louise, maybe I'll start with you. If there's anything in particular that you would have changed, what would that have been?
Is there anything that I would have changed? Gosh, you've do you know what? I wish I could. I think, and this is possibly, I think the power of meeting in person is absolutely huge. It is absolutely huge, and I think, and this is it's something that I sort of reflected on, and I think it would have been good if I could, if me personally, I could have been in Wales a little bit more than I was, and I think that's possibly, I don't know if it would have changed or slowed anything down, but I think the power of in-person events, I think, is really, really key, and I wish we'd have been able to have done more, but within the constraints of time, etc. And we were keen to get going pretty quickly off the mark, but I think, I'm not necessarily saying I would change, but I think it's something to keep really close. And I know it takes a lot more for people to come out of their work into those face-to-face. But in my experience, having done pretty big partnership sessions on a Teams call versus in person, just the depth of understanding of that pathway, you just don't get it. So, but that's because I live in Cambridge, and I would be living on your doorstep if I could be. But Joe, I think it's a really good question, and I probably haven't answered it particularly well because it has been a joy. But I think I would have liked to have run more in-person sessions. Is probably my reflection.
Yeah, no, that's good to know, and I guess we've been reflecting now over where we go next with ongoing engagement. So obviously we're running the 3 pilot sites, and obviously part and parcel of this programme of work is to spread and scale across all of the other health boards within Wales, and I guess it's quite useful that we're having this conversation now, because we've again decided that going forward we need more face-to-face engagement opportunities, so that we can spread and scale and get those same conversations with the other health boards going forward, so that we can make sure that the learning is cascaded across health boards. So yeah, good point. Thank you. I can't see any questions in the chat bar. Anybody want to put their hand up and be brave and ask any other questions? If not, then obviously I can see that there's a couple of links being put in the chat bar to additional useful information, so that's going to be there for you to pick up and use going forward. So if there's no further questions, obviously before we do all disappear and go and get lunch and carry on with our work, I'd just like to obviously say a big, huge thank you to Anthony, Arthur, Louise and Sarah for sharing their time and expertise today. Andrea, I can see your next career being on TV as being an interviewer. But yeah, you've done a great job for leading the discussion, so thank you. And obviously, Christina and Fasako, a big thank you. I know you've been working really hard, coordinating everything today behind the scenes. So big thank you to you. And of course, thank you to all of you for joining us today. Again, your engagement and contributions are what make these sessions really valuable. So again, the recording is going to be available after, and if you've got any colleagues that weren't able to attend today, please do share the recordings, and they'll be on our website. So thank you all. And again, don't forget, if you do want a certificate of attendance, please just drop your contact details in the chat, and we'll forward those after today as well. But thank you, everybody. And 10 minutes back to enjoy the rest of your afternoon.
Yeah. Thanks, Jo.
Thanks, Jo. Bye-bye.
Thanks, everyone.